Hi, I'm Peter, and I'd really like to have a warm welcome back with Dr. Tanya Cates. She is our exercise physiologist who we always go to when it comes to women's health. And today we're going to be talking about returning to exercise after you have had a miscarriage. Thanks so much for joining us, Tanya.
Thank you for having me. I always enjoy our chats together and getting this information out there. So thank you.
Yeah, it's such an important time in a woman's life, and there's no real playbook on what to do after you've had a miscarriage, especially when it comes to your body. So this is why I really wanted to have a frank chat with you about just some suggestions, because there's never any hard and fast rules.
Well, that's the interesting thing, isn't it, from all the reading in this area. And with any exercise, it's very difficult to come up with an appropriate dosage for a specific situation at the best of times. But I think this is worth considering, and it's important to talk about so that we can take care of not just physical health, but mental health as well. That's exercise is such a go-to for that.
It is. And so one of the first things I would like to say is we want women to be really kind to themselves during this period and remember that their body has altered.
Yes, yeah. I guess my first suggestion would be to check in with how are you feeling? How's your energy? Because if you're feeling fatigued from the experience, then consider that in your choices for your exercise. Firstly, if you're going to exercise and if exercise makes you feel good, I would say that to anybody on any given day. But really to be mindful of your fatigue levels and your ability for your nutrition to fuel what you're thinking you might want to do. So, and what makes you feel good? Like, does it make you feel better? And does it make you, get your energy to lift a little bit? Because I think exercise is so important for that. It's a nice way to elevate mood, elevate energy, make you feel stronger, give you a sense of a locus of control in your body.
Yeah, I agree. And it does release endorphins, which is what you really want right now. But I suppose the thing that we want to be really cautious of is that your body has changed and that there are a few things that we want you to keep in mind when you do go back to exercise.
I think with reference to the amount of impact and the load, specifically, I mean, we could speak to the whole spectrum of a time frame of the changes within a body. The consideration of joints is our most important key factor in terms of ligamentous support, avoiding any excessive stretching of ligaments and loading of ligaments with high impact type work. And for me, a point of interest is always what is the cortisol, the stress hormone impact? If people are not sure what cortisol is, there's a certain elevation that can come with high intensity exercise, and we want to make sure that we're not over elevating cortisol levels at already what might be a very stressful time.
Yeah, so things like HIIT, those really high intensity sort of classes.
That will certainly give you that endorphin rush and a sense of you're doing something, but for the longer term impact of that on your energy levels and nervous system function, your ability, to sleep and think and your cognitive load, then yes, I would say it's probably an idea to choose something a little bit more gentle than those explosive like HIIT programs initially.
Yeah. And so one of the rule of thumbs that you and I have been talking about is you kind of just want to continue on with the exercise that you have been doing because your joints have been affected, your pelvic floor is being affected, your ligaments and tendons are being affected. And so for the first couple of weeks, we want you to think, okay, just be kind to my body.
That's right. Firstly, check in energy levels, your willingness and your ability to get out and do some exercise and to consider exactly that. I feel like that's something that has to be a priority is the stability of your joints, the centering of your body, your ability to come from a solid base and foundation in your core, if you like. So to get that initial central control of the body and then move to larger ranges of motion, bigger movements, more impactful movements down the track when they're more available, and because they're initially not not necessary, not relevant, not a priority when you're trying to get nervous system energy back up and, centered.
So there's some really practical tips that we've been talking about from an underwear point of view. So you still want to make sure, like whenever you're exercising, you should have a good bra on, but especially during this period because your breasts have changed and you want to make sure you've got all that really good support.
Well, for your back support, thoracic movement, ability to breathe.
And the other thing is period undies are fantastic. Because you will still have discharge and you will be leaking. And so you don't want that. If you really want to exercise, you don't want that to stop you from exercising. And some of the newer period undies, you can wear the night period undies because they are so much more absorbent and it goes all the way up the back of the underwear.
Yeah, absolutely. I think if that's the thing that's going to stop you moving for all of the other fabulous reasons, then like the cardiovascular benefit, the mental health benefit, the muscle strength benefits, they're your priority from your exercise. We don't want your underwear to be an inhibiting factor. So that can be removed from the problem issues list.
Yeah, and there's so many cheap available options nowadays. Initially, when they first came out,
Was it Target or came out or somewhere?
yeah, Target and Woolworths, all of those major places sell them. Like Bonds have them now. Everyone seems to be doing them.
One other thing about, I think we've talked in the past about compression type garments and just to be mindful of it being like a high performance athlete kind of compression. It's probably unnecessary at that time because it might be like go on the side of what's comfortable and supportive as opposed to a high performance compression because that can be quite restrictive for your organ and your organ function.
A lot of people are talking about recovery shorts. They are slightly questionable. The long-term research isn't there around them, and they're very expensive. So something like a bike short from one of the cheaper places, but maybe in one size smaller than you would normally wear, or even the size that you're wearing, to be honest. But if you want that little bit of extra support, just using something like that will be helpful. The other thing we talked about in the past is swimming or even walking in the water. And now period bathers are around. And interestingly enough, they're cheaper than normal bathers.
There you go. I did not know that.
Yeah. So you can get a set of period bathers for quite cheap.
I think that is the great way to, offload your joints to be in the water and exercise within that environment, but keeping in mind that water has what we call hydrostatic pressure. So in terms of resistance loading, the harder you push water, the harder it pushes back. So initially, just, from a heart rate perspective, just ease your way into it and then build up. It is a nice way and a great environment to build up that resistance training initially. But keeping in mind that you've got a buoyancy factor. So in terms of weight loading for bone density and things like that, we're looking at a different outcome from the water. But initially, I think it's such a great environment.
It's just a short period thing, yeah, and it's quite relaxing. And if you don't want to buy a whole pair of bathers, they have bikini bottoms now. So you can keep your old bathers and just shove your bikini bottoms underneath, like the period bikini bottoms. So there are lots of different options. But I think what you were just talking about was really interesting, especially wanting you to recover from this. And if you do want to go on to try for another baby, we do recommend that you start strengthening all your legs and joints and feet and ankles and anything.
And the upper back strength from having been forward. Yeah. That shift in center of gravity, like be prepared for all of that again, go in with the best strength possible.
Yeah, you want your legs as strong as possible for forever, really, like even as you age. And so as a woman, it's really important.
This is about, your strength as a person as well and your fitness as a person. So fitness beyond all of those great mental health benefits. We have to look after our heart health. We have to look after our bone health and we have to look after maintaining our muscle bulk in terms of that does change later in life. So, we do want a certain level of strength anyway.
Yeah, so it's the best way to age well.
Yes, exactly. And great for you, like maintaining your balance and all of those great general benefits of exercise. So I think, key would be just listen to your body, check in with how it's making you feel, and just build up gradually. Take really gradual steps getting back into or continuing your exercise.
Yeah, I think that's a really good tip. Just take it gradually. The other thing is, if you are a runner, and running is great for your mental health personally, just think about doing some exercises before you start to turn on those muscles in your leg. Before you just go, I'm going to go for a run. And remember, your body has been through a lot. So if you can just do some leg raises or some glute exercises or some quad exercises before you start that run, you're going to start your run with your muscles already active.
Yes. And even just there's really simple like back stabilizing activation exercise, like putting your thumbs into your back and just pressing the muscles next to your spine in your lower back and just rocking forward and back. That kind of triggers those stabilizing muscles to go, oh, there's going to be something happening. And they're prepared to help support you, which I would suggest that, for anyone who's had any disc problem, which is most adults at some point in time, we might not have symptoms, but to get that kind of activation before taking on running and higher impact bounding kind of, even fast walking is really useful. Doing like they call it in yoga or cat cow, like that, bend and flatten your spine to get mobility before other movement is useful.
And something like a pelvic curl or a bridge, whichever you want to call it, or a pelvic press, that's a really good one. It's something you can do with no equipment, lying on the floor, pressing your pelvis into the air. You're turning on your bottom, you're turning on your legs, you're turning on your feet, your calves. It's a really good all-round sort of let's turn some leg muscles on.
And it's triggering to those joints in like the knees and the hips and the ankles that, again, we call it proprioception. So your awareness in space for your balance, etc., and just your general joint strength, that things are about to happen and we're getting ready for it. And if you are going out for like just even a short distance, that's going to set you up really well. Yeah, even sit to stand from the couch a few times.
Yeah, or the dining room chair, that's a bit higher if you want to start like that. The other thing I really wanted to touch on was feet, because one of the big things that comes out around this period in your life is your feet change due to the weight and the hormones.
Are you thinking what I'm thinking, like towel?
Yep, get a towel, put it on the ground and scrunch it with your feet or your toes. Try and make it move. But we would say this to everyone, wear really good footwear. But during this period of your life, it's really important to wear really supportive footwear with arch support.
Yes, there is a lot of footwear around at the moment that is, it's probably not the time for your barefoots and those kind of things, unless you were using them all the way through all the time. You've worn them, if that's what you're used to, then that's a different story. But generally, something that's supportive if you are picking up pace with your walking and starting to get back into a run. Definitely, given that the ligaments have changed, and your feet spread, and absolutely.
Yes, and your shoe size may have gone up. Just be aware of that. So in saying that, I would also be really, when you're at home, things like thongs with arch support and something like Archies. They're not the only brand, but they're a really good brand. Yeah, just to wear around the house, so it gives you that little bit of extra arch support. But any sort of foot exercises are really going to put you in good stead.
And that could be, you're just sitting and you've got your foot on carpet and you're just like scrunching at it. It doesn't have to be a dedicated thing. You could be sitting watching television and doing your feet like preparation. So really great advice.
I suppose what we want to sum this up with is it's really good to exercise during this period, but be kind to yourself. Your body has been through a lot, and so have your emotions. So it's a sort of double-edged sword. You want to really get that energy back, but you don't want to do it to the extent that you're putting your mental health at risk because of the high cortisol levels.
I think that's important to factor in, is that there will be a fatiguing load from the emotional, whether you're consciously recognizing it or feeling it or not. The nervous system goes through a lot, and you may not have the outward effect of that until like any given time. Yeah, and if you're loading like a lot of activity on that, it again, a load of cortisol, a load of a high intensity activity will be even another layer again of fatigue eventually for the nervous system. So to just really gradual, be kind, listen to your body, but enjoy those like good endorphin benefits. And that can come from, it doesn't have to be a high intensity to get that. Just the satisfaction of having set yourself a goal to go out for 5, 15, 20 minutes, whatever it might be, and ticking it off. That can be like dopamine, woo, you know.
Yeah, and I don't want people to think that it has to be like going to the gym. It can just be going for a walk. It can be doing anything, even if you want to do something in your backyard or a YouTube video or of exercise. Anything can be seen as exercise.
Whatever, walking with a friend, having a chat, you know, gardening might be whatever it is for you that is incidentally active or intentionally active. Even just those mini goals, and then gradually build from there. Whatever feels like it's appropriate for you and encouraging for you.
So thanks so much, Tanya, for joining us, and I hope that you could get something out of this if you're listening to it. And remember that it is safe to move. You just want to move safely.
And build up gradually. But enjoy yourself.